Hello, my name is Amy Barmas. I am a physician assistant student. Almost a year ago, I began researching schizophrenia for my research paper, and now I will present that information into a slideshow. So the background and etiology. Schizophrenia affects approximately 1% of the world's population, which is millions of people. While it is believed to have some influences from genetics and environmental factors, the cause of schizophrenia is still highly unknown. People are typically diagnosed during adolescence or young adulthood. Unfortunately, the average life expectancy for a patient affected with schizophrenia is about 10 years less than the general population. Clinical presentation. Psychosis is typically the presenting symptom of this psychiatric disease. Symptoms are described as negative or positive. The way I like to remember which symptoms are correlated with which, I think of negative symptoms as things that patients lack or don't have, and I think as positive symptoms as things that are extra. And so you'll see in my slideshow there is a table that lists negative versus positive symptoms. Auditory hallucinations are one of the more common positive symptoms. Negative symptoms are typically more difficult to treat. Patients that have schizophrenia may also present with cognitive, social, and memory issues or impairment. Mood disturbances can also affect the patient, and depression tends to be the one that's more commonly noted. Negative symptoms are more prominent than positive. Currently, the diagnosis of schizophrenia is based off of clinical findings and by process of elimination. The Diagnostic and Statistical Manual for Mental Disorders, or the DSM, is also a good tool that aids a lot of clinicians in diagnosing schizophrenia based off of certain criteria. A thorough history, physical, and workup is warranted when diagnosing a patient. The process should include ruling out illicit drug use, side effects of medications, brain lesions or masses, and ruling out any kind of imbalance metabolically or nutritionally. Schizophrenia does not have a specific symptom that is pathognomonic for the disease, but there are some that are more commonly associated with schizophrenia, such as paranoid delusions, auditory hallucinations, psychosis. Treatment. So, first line treatment for schizophrenia are still antipsychotics. Antipsychotics are broken down into two classes. You have the atypical medications or second generation medications, and then you have the typical medications or first generation. In my slide, I have a chart that lists atypicals and typicals. Atypicals are preferred over typicals generally. Clozapine is an atypical medication that is generally reserved for patients who are resistant to other medications. Keep in mind that if you place a patient on clozapine, you should monitor them a little more closely. Their side effects can be a little more severe. Psychosocial therapy is also a big part of treatment. So, psychiatry or psychology should be on board. So, really, you need the As far as follow up goes, there's no set rules for when to follow up with a patient with schizophrenia. There are some suggestions that can help guide your clinical judgment. Anytime a medication is started, changed, or dose is changed, a trial of 2 to 6 weeks should be given before making any other adjustments. Follow up as appropriate, based off of your clinical judgment. So if you're changing medications, you can determine when to follow up with them, or, depending on your patient too. Blood work should be done at least annually, but it might need to be done more frequently if you're adjusting medications and therapy, just to monitor for metabolic disturbances or other potential adverse. As far as prognosis and complications, schizophrenia is a lifelong disease that can occur with other disorders such as anxiety, depression, and substance abuse. When pharmacologic and psychosocial therapy are combined effectively, quality of life can actually be greatly improved. Unfortunately, the most commonly used medications are associated with complications involving metabolic disturbances. Typicals are associated with Parkinsonian movement disorders as a side effect, and I know when I see the medication haloperidol, I immediately think of the mouth-tongue twitching movement that's associated with it. Atypicals are associated with the metabolic disturbances. So, weight gain is a big issue with these atypical medications. That can then lead to cardiac and endocrine complications. So, you also have, disease complications just, simply from the symptoms of the disease. A lot of schizophrenics tend to socially isolate themselves, which makes, compliance with medications and compliance with doctor's visits a little bit more difficult. And compliance is with therapy is key to prevent relapse of symptoms. But the side effects and complications from the medications can cause compliance to be an issue with some patients. So, with that said, I do want to mention that there are some medications that come in a long-acting injectable form, and sometimes, depending on where you are, these can actually be given at a pharmacy. So, keep this in mind. It's something that can help improve compliance with schizophrenia. And so, here's my reference slide. I hope this presentation was helpful, and thanks for listening.